Welcome back. Well, as the population ages, the tables are being turned. Adult children are now taking care of their parents, not the other way around. And Jen Tome is here to explain.
Liz, it goes beyond just shoveling the snow for your parents or taking them to the store. Caring for your mom and dad includes going to their medical appointments in some cases. In today's House Call, we're joined by Dr. Charles Cavanero. He's the president and CEO of Wing Memorial Hospital in Palmer and a practicing internist. Dr. Cavanero, navigating the healthcare system is hard for most people and can be especially difficult for seniors. Are there signs that adult children should be looking for to help them determine when to attend their parents' medical appointments?
Well, Jen, thank you, first of all, for inviting me. This is a topic that I think is pertinent to the holidays when generations are brought together, and often adult children can be with their senior parents for some extended period of time, and they can notice some of the signs. We'd like to have people look for excessive weight loss or weight gain on the part of their parents. Is the home safe? Is the appearance of it well kept? Are there problems that might indicate their parents are having trouble keeping the home up? What about the personal appearance of their parents? Are they disheveled? Are they as clean? Sometimes you see people who used to be fastidious will often let their personal appearance lapse. And the other thing is, what's their socialization skills like? Are they still attending events that they used to, or has their world gotten smaller? There are other reasons that children can attend their parents' visits that are far more practical. Simply, they can assist in driving them. They can keep them company at the visit while they're waiting. They can help with the paperwork, which is sometimes exhaustive, and they can also offer to meet with a doctor.
Well, do you have any tips for children when they first approach their parents? Because it can be difficult because tables are really turning.
I think the easiest thing is to basically be frank with your parent and voice your concern for their health and your willingness to help them. But at the end of the day, they're still free agents, and it's really a matter of personal choice. They might accept or reject your offer to help. But even in the event that they don't want you at their doctor visits, if in fact you feel that there's something you want to make their physician aware of, you should feel free to write a letter. I wouldn't expect that you would get something in return because there are privacy rules about this, but any information the doctor has is helpful.
What about just engaging the parent in a conversation with the child about their medical needs? Is that something that might be a good idea as they age?
I think if you're actually able to attend the visit, there are a few rules, I would say. The first, it would be, since it's the holiday season, the Santa rule. Make a list, check it twice, bring it with you. It's always nice to have that list and refer to it because the time of the visit is often shorter than one thinks, and it's nice to be able to refer to the list and make sure that all those questions are answered. It's always good also to have medications and to understand what they're really taking and that they understand what they're taking.
Okay.
They also have to bring to the appointment an open mind. You always need to remember that your adult parents are free and autonomous, and things that may be important to you may not be as important to them. Safety and autonomy, they're always a trade-off, and you need to keep that in mind.
Well, thank you very much for your advice today, and I think you answered a lot of our questions. Now, if you have questions about a medical topic you would like to ask during a live Skype interview, just email us at housecalls@cbs3springfield.com. We'll be right back.